The gentlewoman from Texas, Ms. Johnson, is recognized for 5 minutes.
Mr. Speaker, the American Health Care Act, the Trump Care, does one simple thing. This short-sighted Republican plan forces Americans to pay more to get less. It is nothing more than a tax break for the wealthiest at the expense of the most vulnerable. Today, joining every major responsible group for providing health care to Americans, including the American Hospital Association, the AARP, the National Physicians Alliance, the American Medical Association, and the Association of American Physicians and Surgeons, the National Nurses United, a group representing over 150,000 registered nurses, wrote to Congress urging us to oppose the American Health Care Act. Registered nurses care for Americans in their most difficult hours, from our first breath of life to our final. Nurses are integral in the delivery of health care in our country. More than any other profession, nurses see the personal effect of a flawed health care system in the hospital every single day. I know, Mr. Speaker, because I was the first former registered nurse in the House. I have a first-hand and valuable perspective and insight nurses have into our healthcare system. We should take their heed alongside the public outcry about the danger of this so-called replacement bill. These are not paid protesters going to town hall meetings across this country. These are our constituents participating democratically, but telling their representatives that they want to keep and improve the current law, not repeal and replace. This proposed plan replaces nothing for the 24 million Americans who would lose coverage as a result of this ill-derived legislation. In my district alone, President Obama's Affordable Health Care Act brought the uninsured rate down from 27.3 to 20.8 and insured over 265,000 individuals who did not have coverage before. While the main safety net provider in my district, Parkland Hospital, provided $1 billion in uncompensated care in 2015. Parkland and the other safety net providers face severe financial burdens in the House GOP proposal. One of my main concerns with this bill is that it punishes people who get their coverage through Medicaid by capping and slashing the program. With 70 million Americans and 5.2 million Texans who currently rely on Medicaid, per capita caps on the program would meet not the needs of the population, and the people would suffer. People will live or die as a result of our decisions here on this floor, Mr. Speaker. There's no reason for the Republican leadership to rush this legislation without careful consideration, including the input of those who actually provide health care. We need to listen to our constituents, our nurses, our doctors, our long-term care aides, and our hospitals. We must listen to the people. This bill will force Americans to pay more for their premiums, more for their care, more for their medicines, more out-of-pocket expenses and deductibles, all the while giving tax breaks directly to the wealthy. I urge my colleagues to consider the harmful effects of this bill. Your constituents are asking you to work with us to repair the Affordable Care Act, and we are ready to work. Mr. Speaker, I would ask permission to put this correspondence from the National Nurses United into the record. Thank you, and I yield back.
Without objection, the gentlewoman from Texas yields back. The chair recognizes the gentleman from Kentucky, Mr. Comer, for 5 minutes.